In the city of Boston in particular, there was very little access to healthcare for those who were underserved. People had to take 3 bus rides to get to Boston City Hospital to wait sometimes several hours to be seen. Columbia Point started with more mothers and children, but rapidly became a go-to place for those who did not have access to services, who did not have the money to pay for those services, and were welcomed into that health center. And that was the case of Columbia Point from the very beginning. All are welcome here.
Very positive impact on healthcare because people had this healthcare in their neighborhood. There were a lot of residents hired to work in the health center. And a lot of those people went on to make careers in community health, neighborhood health. And there are all kinds of stories like that of generational career building. The idea of integrating behavioral health, social health, and medical health all in one team. And by the way, there was also a pharmacy in the building.
For me, growing up in Columbia Point and being part of the first community health center, I feel like our community health center back then was a place where people really cared, not only about your health, but about your mental state of mind, about where you were living, where your kids were playing. The health center definitely seen everyone as a whole person. It wasn't about this person coming in and fighting the flu. It was like, oh, I know you're not feeling well. You know, did you eat today? Like, who's taking care of the kids? I can just remember the doctors really listened. We talk about innovative care. So I think about the mammogram van. And when I went on that van that day, it changed my life forever. I'm so thankful because if I didn't do that exam and knew what to look for, I wouldn't be here today. And that's the power of community health center, right?